Many people don't realize that high blood sugar can be silently harming their bodies for years before any serious symptoms appear. In fact, according to the Centers for Disease Control and Prevention, about 1 in 5 people in the United States who have diabetes don't know they have it. That means millions of people are living with dangerous blood sugar levels, with no idea of the damage happening inside. When your blood sugar stays high over time, it's like having a small fire burning inside your body, slowly damaging your blood vessels, nerves, eyes, and kidneys. And just like a fire, the longer it burns without control, the harder it is to fix the damage later. That's why catching the early signs is so important. You might think that serious health problems come with clear warnings, but high blood sugar is often called a silent danger because its early signs are easy to miss. Many people blame fatigue, thirst, or blurry vision on stress, age, or not getting enough sleep, but these could be your body's way of saying something is wrong. Recent studies show that people with prediabetes, meaning their blood sugar is higher than normal but not high enough to be diabetes, often have no idea about their condition. In the US, this applies to over 80 million adults. And without early action, many of these people will develop full diabetes within 5 years. Imagine this like a slow leak in your home's water pipe. At first, you don't see or feel anything wrong, but over time, that leak can damage your walls, floors, and foundation. By the time you notice, the repairs could be costly and difficult. The same goes for your health. Paying attention to early signs of high blood sugar can help you take action before serious problems appear. In this video, we'll guide you through the early signs of high blood sugar, so you can protect yourself and your loved ones. Don't wait for complications. Small changes today can save you from big troubles tomorrow. Sign 1: constant thirst and frequent urination. One of the earliest and most common signs of high blood sugar is feeling thirsty all the time, even when you drink water regularly. This happens because too much sugar in your blood pulls water out of your body's cells. Your body tries to balance things out by getting rid of the extra sugar through your urine. As a result, your kidneys work harder to filter the sugar, and you end up urinating more often. When you urinate more, you lose more fluids. That makes you feel even thirstier, creating a cycle that can be hard to break without controlling your blood sugar. This is not just about drinking more water on a hot day or after exercise. This is a type of thirst that feels like it never goes away. No matter how much you drink, people with high blood sugar often find themselves waking up at night multiple times to use the bathroom. But it's not just at night. You might notice that you're planning your day around bathroom trips or avoiding long drives because you worry about finding a restroom. Recent health research shows that when your blood sugar is too high, your body enters a state called osmotic diuresis. This means your kidneys are forced to pull extra water from your blood to flush out the sugar. Over time, this can lead to dehydration, which makes other symptoms worse, like fatigue and headaches. Imagine someone who drinks large amounts of water at work, keeps a water bottle nearby at all times, but still feels dry-mouthed and thirsty. They might think it's just stress or working in an air-conditioned office. But the real cause could be high blood sugar that needs attention. By recognizing this early sign and talking to a doctor, you can take action before it leads to more serious health problems. Don't ignore constant thirst and frequent urination. They could be your body's way of asking for help. Sign 2: unusual fatigue and weakness. Feeling tired is something we all experience from time to time, but when your fatigue seems unusual or doesn't improve with rest, it could be a warning sign of high blood sugar. When your body has too much sugar in the blood, that sugar can't move into the cells to be used as energy. Instead, it stays in your bloodstream. As a result, your muscles and organs don't get the fuel they need, and you start to feel weak and worn out. This type of fatigue is different from being tired after a busy day or not sleeping well. It's a deep, lasting tiredness that can affect you even after a full night's sleep. You may feel like simple tasks, such as climbing stairs or carrying groceries, take much more effort than they used to. Studies have found that high blood sugar levels can slow circulation, meaning less oxygen and nutrients reach your body's tissues. This adds to the feeling of weakness and may also cause headaches or make it hard to concentrate. Imagine someone who works at a desk job and notices they're feeling drained by mid-morning, even though they had breakfast and didn't stay up late. Or think of a parent who struggles to keep up with their children, feeling unusually tired during simple activities like playing in the yard. They might blame it on age or stress, but high blood sugar could be the real cause. High blood sugar can also lead to dehydration, which makes the fatigue even worse. When you lose fluids through frequent urination, your body has to work harder to keep everything in balance. That's why it's important to pay attention to tiredness that doesn't make sense and to speak with a doctor if you notice this happening often. Recognizing this early can help you take steps to manage your blood sugar before more serious health problems appear. Sign 3: increased hunger without weight gain, or even weight loss. Another early sign of high blood sugar is feeling hungrier than usual, even after eating full meals. This happens because, when blood sugar is too high, the sugar stays in your bloodstream instead of moving into your cells. Your cells are not getting the energy they need, so your body keeps sending signals that you need to eat more. You might think that eating more means your body is well fed and getting stronger. But in this case, the extra food isn't reaching the places that need it most. Your body is actually starving at the cellular level, no matter how much you eat. Over time, this can lead to weight loss, because your body starts breaking down fat and muscle to try to get the fuel it's missing. This is not the normal hunger you feel after exercise or skipping a meal. It's a hunger that feels hard to satisfy and keeps coming back quickly. Some people notice they're eating larger portions or snacking more often, but their weight stays the same or even drops without trying. Health experts explain that when the body can't use sugar properly, it starts to burn fat and muscle for energy. This not only causes weight loss but can also lead to weakness and make you feel more tired. Imagine someone who starts eating bigger breakfasts, larger lunches, and still feels hungry before dinner. They might think their metabolism is speeding up, or that they're just more active, but the real reason could be high blood sugar that's going unnoticed. If you or someone you care about is eating much more than usual but not gaining weight, or even losing weight, it's important to talk to a doctor. Recognizing this sign early can help prevent serious complications later. Sign 4: blurred vision and slow healing wounds. High blood sugar can affect many parts of the body, and two common early signs are blurred vision and wounds that take longer to heal. When your blood sugar is too high, it can damage small blood vessels over time. In the eyes, these damaged vessels can leak fluid and cause swelling in the lens, making it harder for you to see clearly. You might notice that things look blurry, like you're looking through a dirty window, or you may find it harder to focus on words when reading. The same damage happens in the small blood vessels that supply your skin. When these vessels are harmed, less oxygen and fewer nutrients reach the skin. This makes it harder for even small cuts or scrapes to heal properly. Your body's natural repair system slows down because the tissues don't get what they need to recover. Unlike vision changes that come with age, blurred vision from high blood sugar can appear suddenly and may come and go as your sugar levels change. You might think you just need new glasses, but the real problem could be inside your body. For example, someone who gets a paper cut at work might notice that it stays red and open for days instead of healing like usual. Or a person who accidentally scrapes their leg gardening may find that the scab takes much longer to form and close up. These are not just minor annoyances, they are signs that high blood sugar could be slowing your body's healing process. Experts explain that high blood sugar also weakens your immune response, making it easier for infections to take hold. This can turn small wounds into bigger health problems if not treated properly. That's why it's important to pay attention to these signs early and speak with a doctor if you notice them happening often. Sign 5: tingling or numbness in hands and feet. One of the signs of high blood sugar that often goes unnoticed at first is a tingling or numb feeling in your hands, feet, or fingers. This happens because high blood sugar can slowly damage the small nerves in your body, a condition known as peripheral neuropathy. When nerves don't get enough oxygen and nutrients due to damaged blood vessels, they stop working properly. This nerve damage can create a strange sensation, like pins and needles, burning, or a slight loss of feeling. What's important is that this isn't the same as the numbness you might feel after sitting in one position for too long. With high blood sugar, the tingling and numbness can happen at any time and may not go away quickly. Experts explain that peripheral neuropathy often starts at the furthest points of your body, such as the toes and fingertips, because these nerves are more delicate and farther from the heart. As the damage progresses, the sensations can spread up the legs and arms. For example, imagine someone who notices their feet feel asleep while they are walking or standing, not just when sitting for a long time. Or think of a person who struggles to button a shirt because their fingertips feel numb or clumsy, even though they haven't been in an awkward position. If high blood sugar continues to damage the nerves, the tingling can turn into pain or complete loss of feeling. This can increase the risk of injuries. because you might not feel a cut, blister, or burn on your foot or hand. That's why it's important to take tingling or numbness seriously and check with a doctor. Recognizing this sign early gives you a better chance to control your blood sugar and protect your nerves before the damage becomes permanent. Sign 6. Darkened skin patches, especially neck or armpits. Another early sign that may point to high blood sugar is the appearance of dark, velvety patches of skin, often on the back of the neck, under the arms, or around the groin area. This condition is called acanthosis nigricans, and it is commonly linked to insulin resistance. When your body starts to have trouble using insulin properly, insulin levels rise, and this can trigger skin cells to grow more quickly and produce extra pigment, leading to darker skin in certain areas. These patches are usually soft to the touch and may feel slightly thicker than the surrounding skin. They are not painful or itchy in most cases, so many people don't notice them right away or think they are simply from dirt or sweating. However, these skin changes can be an early clue that your body is struggling to manage blood sugar effectively. Unlike normal skin darkening from sun exposure, these patches often appear in body folds or creases where friction happens. Health experts note that people who are overweight or have a family history of diabetes are more likely to develop these skin changes when blood sugar is too high. Picture someone who starts to notice the skin on the back of their neck looking dirty or stained, even after washing carefully. Or think of a person who sees dark patches in their underarm area that seem to spread over time. They might try scrubbing harder or using different soaps, but the discoloration stays. If you see these kinds of skin changes, it's important to talk to a doctor. Identifying this sign early can help you take steps to manage blood sugar and prevent more serious health problems in the future. Sign 7. Frequent infections, yeast, skin, gums. High blood sugar weakens your body's ability to fight off germs, making you more likely to get infections. When sugar levels stay high, they create a perfect environment for bacteria and yeast to grow. This is why people with high blood sugar often notice infections that come back again and again. Even after treatment, yeast infections are common in areas where moisture builds up, like under the breasts, around the groin, or between skin folds. Women may experience frequent vaginal yeast infections that cause itching, discomfort, and unusual discharge. Skin infections such as boils or inflamed hair follicles can also happen more often when blood sugar is too high. Another area affected is the mouth. High blood sugar can increase the risk of gum infections, known as gingivitis or periodontitis. People might notice red, swollen gums that bleed easily when brushing or flossing. Left untreated, these gum infections can lead to tooth loss and other serious health issues. Unlike occasional infections that clear up and don't come back, these infections tend to return or take longer to heal. For example, someone might treat a skin rash with cream, only to see it return in a few weeks. Or they might go to the dentist for a gum problem that keeps flaring up despite good brushing habits. Experts warn that frequent infections are a sign your immune system is under stress, and high blood sugar could be the cause. Paying attention to this early signal and working with a doctor can help you prevent more serious health problems in the future. If you've noticed any of the early signs we've discussed, the good news is that there are simple actions you can take today to lower your risk of diabetes. The key is to act early, before more serious problems develop. First, focus on healthy eating. Try to build your meals around vegetables, lean proteins like chicken or fish, whole grains, and healthy fats such as nuts and olive oil. Reduce your intake of sugary drinks, processed snacks, and refined carbs like white bread or pastries. Instead of drinking soda, switch to water or unsweetened tea. Making small changes, like adding one more serving of vegetables to your dinner, can make a real difference. Second, make physical activity part of your daily routine. You don't need to join a gym or run miles. Even 30 minutes of brisk walking, cycling, or dancing can help your body use insulin better and keep your blood sugar in check. For example, taking a walk after dinner or choosing stairs instead of the elevator can be easy ways to get started. Third, keep an eye on your weight. Losing even a small amount, around 5 to 7% of your body weight, has been shown to greatly reduce the risk of developing type 2 diabetes. Fourth, don't forget about stress. Ongoing stress can raise blood sugar levels and make it harder to stay healthy. Simple habits like deep breathing, stretching, or spending time outside can help you relax and support your health. Finally, schedule regular checkups. If you have a family history of diabetes or other risk factors, ask your doctor about testing your blood sugar. Early testing and monitoring can catch problems before they become serious. The most important thing is not to wait. Small steps you take today can protect your health in the long run. Don't just listen, take action now. High blood sugar is often called a silent threat because it can quietly damage your body for years before any serious symptoms appear. But by learning to spot the early warning signs, you can take steps now to protect your health. Ignoring these signs doesn't make the problem go away. In fact, waiting too long can lead to complications like nerve damage, vision loss, kidney problems, and heart disease. The good news is that small actions today can make a big difference. Pay attention to your body. If you notice things like unusual thirst, fatigue, blurry vision, or frequent infections, don't brush them off as stress or age. These could be signs that your blood sugar needs checking. Talk to a doctor, get tested, and make healthy choices that support your well-being. Remember, diabetes and its complications don't happen overnight. They build up over time, but so do the benefits of taking action early. If this video has helped you understand more about the early signs of high blood sugar, please subscribe to this channel. That way, you won't miss future health tips. Share this video with friends and family so more people can stay informed. And most importantly, take what you've learned today and use it to protect yourself and your loved ones.